Good afternoon, everyone, and thank you so much for joining us. This is Marbella from NEDIC, and I'm here at the West Durham Family Health Team with Kori Kostka, a registered dietitian, and we are here to bring you the webinar, Managing Diabetes with a Mindful Eating Approach. As usual, there's a chat box in the bottom right-hand corner. If you have any questions or feedback, please feel free to type in there. Also, if you find that your connection is a little bit shaky, it sometimes helps to close the window and then open it back up again. So today's presentation asks, is it possible to manage your blood sugar levels without the fear of food and the preoccupation with carbohydrates, sugar, calories, portions, etc.? In our fast-paced environment, managing our blood sugar may feel like another full-time task on top of your already busy life. Using a mindful approach, it can help lower the burden and stress of diabetes and find a way to re-look at living with diabetes in a practical way that works for you. Join us for this mindful approach to eating, moving your body, and feeling great while living with diabetes. So Kori Kostka has facilitated a few webinars for us here at NEDIC, and she's a registered dietitian at the West Durham Family Health Team here in Pickering, Ontario. Here she's implemented help at every size among the staff and patients. In her private practice setting, Core Nutrition, she runs various mindful eating retreats with the community. Kori has a passion for spreading positive body image and HAES messages through social media daily. She is actively part of the Selhen Health Professionals Advisory Committee and previous vice chair of the DCON FHTRD network and previous secretary of the Association for Science, Diversity, and Health. She is currently working on a mindful eating app that will be released soon. So without further ado, I'm going to hand it over to Kori, who's going to start the presentation.
Thank you to Marbella for that introduction, and good afternoon, everyone. Thank you to all of you for joining us, and once again to NEDIC for hosting today's webinar and inviting me to speak today. So as Marbella mentioned, today I'm going to talk a little bit about, from my standpoint, how I coach patients either newly diagnosed with diabetes or even pre-diabetes, which I'll talk about some of the definitions for those who are unfamiliar later on. So for those of us who are clinicians on the line, keep in mind that the way I'm presenting today is more of just showing you how I do this with clients and patients, so it's a little bit more of a practical presentation. I do have a bunch of references and resources at the end in case you want to know where some of this literature is coming from. So as mentioned, today I'm going to explain diabetes using our digestive system and carbohydrates as a way to fully understand how things work in our bodies. Hopefully this will also help to clear up some myths about managing our blood sugar levels and then show you how mindful eating can actually help to manage your blood sugar levels. And like I said at the end, I do have a bunch of references and resources that I will point out along the way. What is diabetes? Before I explain what diabetes is, it's helpful to understand how the body actually works. After you eat foods with carbohydrates, so these foods might be things like pasta, rice, cereal, bread, cakes, sweets, cookies, syrups, milk products, yogurt, fruits, some vegetables, table sugar, etc. Carbohydrates are broken down by our digestive tract into the simplest form of sugar, which for some of us know this is called glucose. And this is why a lot of people might use these titles interchangeably, blood glucose and blood sugar. Glucose then goes from our digestive tract into our bloodstream, causing our blood sugar levels or blood glucose levels to rise. This is the reason why many foods contain carbohydrates, and I'll explain a little bit about the importance of this later on. Glucose is necessary. We need to eat carbohydrate foods to get enough glucose into our body, as it's the preferred energy source for our body and must travel from our bloodstream into our cells to be used up as energy. Most cells need insulin, though, to be released from our pancreas, which is shown here, and that's the key that helps to unlock our cells so that glucose can actually get in there. So our cells might be things like our muscle cells, our heart cells, our lung cells, and even our brain. Some of you might be familiar with insulin resistance, but when things aren't really processing well, or our sugar isn't efficiently being absorbed, it might be a cause from insulin resistance. This is when the cells no longer listen to insulin and don't open up to receive glucose into the cell. If you have insulin resistance, you might notice you feel tired, hungry, but when you eat foods that have carbohydrates, your body cannot get the sugar or the glucose from the bloodstream into your cells to be burned up. So you might feel even more tired and hungry. Insulin levels can spike, which then cause insulin to store glucose as a fat source. And if your body isn't making enough insulin, your blood sugar levels can actually skyrocket. This can also cause you to feel thirsty and urinate more, especially at nighttime. You might have heard of the 3 Ps: polyphagia, which is eating more, polydipsia, which is drinking more, and or polyuria, which is peeing more. Many people, though, don't show any symptoms at all. Sometimes as you gain more and more weight because of this insulin resistance, this actually causes your cells to be more resistant to insulin and contributing to developing diabetes or worsening your diabetes. This is why weight gain isn't really entirely your fault, nor is it entirely helpful to focus on. If your cells are becoming more insulin resistant, you'll feel even more tired and hungry, making it difficult to have energy and motivation to take care of your body. If you hear the suggestion to lose weight, it usually isn't very helpful. Focusing on what's contributing to your insulin resistance may actually give you more bang for your buck, with or without weight loss. Looking at behavior changes and other things that cause our cells to be more sensitive to insulin, meaning they're more responsive to it, might be more helpful and empowering. Once our cells are actually full, meaning they have enough glucose, if there's any extra glucose floating around in our bloodstream, this might cause hyperglycemia, which is higher levels of sugar in our bloodstream. The liver then is triggered to make glycogen, which is a temporary storage of glucose in our liver and muscle cells. After a few hours, blood glucose and insulin levels return to normal if our body is working efficiently. Once our glycogen levels in the liver and muscles are full, insulin's secondary job then is to carry excess glucose and to be stored in our fat cells. So we've talked about one way of getting glucose or sugar into our bloodstream is from eating carbohydrate foods. But when you're fasting, either sleeping or if you've skipped a meal, the glucose we just saw stored as glycogen is actually released into your bloodstream to ensure your body has enough glucose to feed your cells. I will explain this model a little more in detail. So again, our muscles and our liver have that short-term storage of glucose, which gets released into the bloodstream. Let's use a car as an example in summarizing what we've just gone through. Let's compare blood glucose levels to how the car operates. If our car is operating and running efficiently, our gas light turns on to tell us our fuel or our blood glucose levels are running low. We can choose to head to the table or the gas pump to get more fuel. Our body needs a mixture of nutrients, but it especially needs carbohydrate sources. The gas tank is a reservoir of fuel that is only taken by the fuel pump as needed, much like how insulin helps to pull glucose or sugar from our bloodstream and deliver it as needed to our cells to be burned up as energy. So our cells here are pictured as the engine of the car. Hopefully this provides a better understanding of diabetes, so these definitions will make sense. Prediabetes refers to when our blood glucose levels are higher than normal but not yet high enough to be diagnosed as type 2 diabetes. In type 1 diabetes, our body's immune system, for whatever reason, destroys insulin-producing cells in the pancreas, and the body can no longer make insulin. This is why people with type 1 diabetes need to take insulin from outside the body to inside the body to manage their blood sugar levels. Type 2 diabetes is where the body may or may not make enough insulin, or the cells become insulin resistant, as we discussed earlier. Gestational diabetes is a type of diabetes that might be temporary and occurs during pregnancy. Your body cannot produce enough insulin to handle the effects of a growing baby, or it might also be the changing hormone levels that influence your blood sugar management. Oftentimes, when patients or clients or ourselves hear a diagnosis of diabetes, we're bombarded with all the negative side effects of diabetes. The way I like to look at this is by taking care and managing your blood sugar levels. These are all the benefits you actually receive. Your tissues, your cells that we talked about, actually get enough glucose to help protect our eyes, our eyesight, our kidneys, our nervous system, especially our brains and nerves, and it actually can prevent or delay the development of cardiovascular disease, protects our limbs, especially our feet, and sexual health, especially for men. I'm going to talk about the starvation mechanism a little bit later on, but having enough glucose in your body actually prevents the breakdown of fats and proteins. We'll talk a little bit about what are some of the downsides to the body using fats and proteins. Often when people get diagnosed with diabetes, they think sugar is the bad guy. However, if you're not eating enough carbohydrates, which remember break down into glucose or sugar, the body senses a drop in glucose levels, and the hormone glucagon is released and actually triggers that glycogen we saw to be broken down for energy by the muscles and liver cells. Glucose is either used up for energy by the muscles or released back into the bloodstream by the liver. Glucagon also stimulates fat tissues to be broken down and released into the bloodstream. Glucose can also be made by the liver by absorbing amino acids from proteins that are broken down and fat from the bloodstream to convert into glucose and release back into the bloodstream. Some of us might think, isn't that actually a good thing? Well, we actually call this state the post-absorptive state. When your body's not eating enough to absorb the nutrients necessary for your body, it draws on internal reserves to continue daily functions. Our brain, for example, needs at least 130 grams of carbohydrates per day to function normally. 12 hours a day, we're supposed to be in this post-absorptive state. While we're sleeping, as our body continues to feed our lungs, heart, brain, etc. But when we skip meals and if we don't eat enough carbohydrates throughout the day, it can actually extend this post-absorptive state. The pie chart shown here shows how much reserve a typical 154 pound person has. Fats have a higher energy content and take up a larger percentage of our total reserves, mostly from what we call triglycerides. Protein comes next, mostly coming from our muscle tissues, which we want to protect and keep. Carbohydrates, we only have a short, small supply, meant to only last for a few hours or at most overnight. As the body senses a post-absorptive state, blood glucose levels start to drop, and the liver responds by breaking down that glycogen, which turns it back into glucose, and releasing it into the bloodstream. This can only last for about 4 hours. As glycogen is used up from our muscles and liver, the liver actually begins making glucose from fats and amino acids. The byproduct of fats being broken down are what we call ketones. When amino acids are broken down, the byproduct is ammonia, excreted by urea by the kidneys, which is why sometimes high-protein diets can actually overwhelm your kidneys. The bloodstream normally carries some ketones, but few appear in our urine. A brief period of fasting, though, is enough to increase ketone production and can actually cause what we call ketosis, high concentrations of ketones in our body fluids, such as blood and urine. That fruity breath smell, if you've ever smelled that, results from acetone being formed during ketosis. So why are ketones so harmful? Well, temporary elevated levels aren't too dangerous, but it can threaten the pH balance of our bloodstream, if you remember back to biology. The body can temporarily release buffers to prevent the blood from becoming too acidic. As ketone levels rise, the body's buffering capabilities cannot keep up, and the pH levels can drop dangerously low, causing ketoacidosis. This is when the blood becomes acidic and can actually cause coma, cardiac arrhythmias, and even death. In diabetes, our body tissues cannot use glucose when there's not enough insulin, or the cells become insulin resistant, as we discussed. As a result, the body continues to use proteins and lipids to survive, but produces large numbers of ketones. This can cause diabetic ketoacidosis, the most life-threatening form of ketoacidosis. This is why your doctor will check for ketones in your urine. Finally, our muscle storage of glucose can only provide enough for a good night's sleep. The post-absorptive state continues for longer periods. Muscle proteins will be broken down, which we want to keep because those are metabolically active. And body cells begin to decrease their need for glucose as fat and ketone levels rise and blood glucose levels fall. This is why many may report after a few weeks they notice their carb cravings actually disappear. This may not be a good thing. It means your body is trying to conserve energy to make sure your brain is fed. Your brain and neural tissues need a constant supply of glucose flowing through the nervous system. Prolonged periods of starvation or post-absorptive state will then cause the neural tissues to use ketones, and causing that blood to become more acidic. The post-absorptive state can be maintained for a considerable period of time, but in order for the body to function efficiently, your digestive tract is designed to regularly absorb fluids, nutrients, minerals, and vitamins, and this includes carbohydrates. This is what we call nutrition. Now that we understand diabetes, the different types, and what impacts our blood glucose or blood sugar levels, we can talk about behaviors that can help you to manage your blood sugar levels. Or another way to look at this is, how do we make our cells more insulin sensitive, meaning they respond to insulin the way they're supposed to. I'm going to show you a tool which some of you might be familiar with, our hunger fullness cues, but it's also to point out here stress. In recent years, chronic stress and depression as independent risk factors for decreased insulin sensitivity, causing insulin resistance, and the development of diabetes have been talked about more and more. However, understanding how this mechanism actually works in terms of insulin resistance and acute psychological stress is a bit limited still. Family and social support have positively impacted our management of blood sugar and self-care behaviors. In both type 1 and type 2 diabetes, interventions that have targeted our family's ability to cope with the stress of the diagnosis of diabetes have resulted in fewer conflicts, and having partners involved in care has been found to impact and help to manage blood sugar. Diabetes is more prevalent with people living with depression, anxiety, and eating disorders. And worse outcomes might be related to lower motivation for self-care, but also because of quality of life and the impacts that a diagnosis due to lack of social supports, negative perceived attitudes about diabetes, and feeling overwhelmed by the list of self-care activities related to diabetes. This also can be referred to as diabetes distress. Number 3 is physical activity. Generally, we can give out prescriptive recommendations to be 150 minutes of moderate to vigorous, intense, aerobic, and flexibility type activities per week. For example, 30 minutes 5 days a week. But what does that mean to the common person? Well, it's looking at, yes, the benefits of these types of activity. For example, aerobic activity increases our fitness, which fitness really means how well our heart and lungs deliver nutrients like glucose and oxygen to our body, and can actually slow one of the side effects of diabetes, which is peripheral neuropathy. Insulin sensitivity and bone health, quality of life are impacted by flexibility type activities like yoga and Tai Chi. But more importantly, it's learning how to make activity intuitive and mindful, just like our food choices, which we'll talk about soon. And also keeping in mind that our activities don't have to sweat and burn to be able to count. We can also do these activities in 10-minute increments that show considerable impact on our blood sugar management. So having fun and learning ways you can move your body that are sustainable and comfortable is more important than the minutes, the calories burned, and the type of activity that you're doing. Number 4 is nourishment. And sometimes I like to use this instead of nutrition, but it's looking at our plate a little differently. And I have some visuals I'll show you on how to do that. Sleep. Partial sleep deprivation during only a single night can actually influence insulin resistance in multiple metabolic pathways, not even just in people with diabetes, but even considered healthy subjects as well. If you're not getting enough sleep, it's important to talk to your doctor about what behaviors might be helpful. Keep in mind not to accept the recommendation to lose weight as an answer. Your body could actually be gaining weight or holding on to weight because of the lack of sleep. Keep in mind weight loss is actually an outcome. It's not a behavior. Number 6 on there is alcohol. Moderate alcohol intake is considered 2 to 3 standard drinks per day. And this recommendation is the same for people even living without diabetes. But especially for people who have diabetes, alcohol increases insulin secretion, which can trigger low blood sugar, or what we call hypoglycemia, and can also impair the hormonal responses that would normally manage low blood sugar levels, like what we talked about with the liver and muscle cells spitting out the glycogen storage into glucose. Even 2 ounces of alcohol on an empty stomach can lead to very low blood sugar levels. So it's important to make sure, if alcohol is part of your intake for the day, that you have this around meal times. And finally, on their medications are designed to help manage diabetes in different ways. Some have mechanisms of action that help to manage blood glucose levels by preventing the liver from releasing glucose into the bloodstream, and by increasing the sensitivity of our muscles and fat cells to use insulin so that that removes glucose from our bloodstream. Talking to your doctor or pharmacist for more information about how these medications work or which ones might be helpful for you can be a really important part of managing that insulin resistance and making ourselves more sensitive to insulin. So as promised, I'm going to talk a little bit about mindful or intuitive eating, as I've mentioned it, but haven't really fully explained it. So the Canadian Diabetes Association suggests that our A1C, which is a 3-month average of how much sugar or glucose is floating in our bloodstream, can be lowered by 1 to 2% and improve clinical and metabolic outcomes just through managing our lifestyle behaviors. Research also shows that linking with a registered dietitian, and I've listed Eat Right Ontario as a resource where you can call a dietitian for free, who could connect you also to a dietitian in person if you'd find that helpful, can help to manage our diabetes for the long term. The guidelines also suggest that interacting with a dietitian every 3 months can be a really helpful part of managing these lifestyle behaviors for you. Intuitive and mindful eating helps us to use our internal body cues, such as our hunger fullness cues, but also how we feel to determine what lifestyle behaviors actually work best for our bodies. Everyone has an idea of what's going to work for you, but it's figuring that out for yourself from all that information we get bombarded with. We're all born with these cues, but often too we're also taught to ignore them and get distracted by what we call external measurements, rather than those internal cues that our bodies are built to receive and send to us. Responding to these cues is a bit different than what we're taught by using traditional dieting methods. But many of us don't realize we're using nutrition as a weapon instead of a tool in a toolbox. Look at the benefits of doing it mindfully and how it can actually help. So looking at our physiological hunger, which again for many years we might have turned off, and finding what's comfortable satiety, maybe not feeling full, but just feeling like we can come away from the table feeling satisfied. It impacts our mood, our energy levels, and can actually influence our bowel movements. It can also help us to look at how to manage emotional eating a little bit differently. So savoring and appreciating good food almost is something that we might have to relearn. We once did it, but now we have to get back to that body knowledge. So it's not just about calorie counting or carb counting, but it's looking at the way we eat our food and how we eat our food that will help in the long term. So rebecoming someone who's intuitive or mindful, excuse the typo in the title there, tend to have higher self-esteem, proactive coping skills, greater optimism, greater satisfaction with life, and body mass index is a measure of how much mass our body has. It seems to be more stable for people. Not even necessarily has to be lower, because we're all designed to be at different sizes and shapes. And this can also help with our body self-esteem. And by doing all of these things, we also see that people can manage their blood glucose levels more efficiently too. So what is mindful eating? How do we do this? Mindfulness helps our attention and awareness on the present moment, which in turn helps us disengage from habitual, unsatisfying, and unskillful habits and behaviors. Engaging in mindful eating practices on a regular basis can help us rediscover a far more satisfying relationship with food and eating than we ever imagined or experienced before. A different kind of nourishment often emerges, the kind that offers satisfaction on a very deep emotional level. This is the definition from the Center for Mindful Eating, which I provided the link for you at the end. But it's looking at the plate a little bit differently. Coming to the table and tasting versus being distracted is what we call being aware. Savoring our food is noticing not the diabetes prescribed foods, but the textures, the aromas, the flavors. What is it that we actually prefer on our plate? Crunchy, sweet, salty, smooth, spicy, etc. And observing, what level of hunger am I at right now? Do I have low energy? Am I stressed? Am I satisfied? Am I full? How long does this food actually fill me up for? Being in the moment means that we have less distractions. We don't have a cell phone in our hand, the newspaper, a book. We sit and we eat, and non-judgmentally, which can often be a challenge when we get diagnosed with diabetes because of all the stigma attached. Sitting mindfully, non-judgmentally means getting away from the labels of this is diabetic food, or I have to follow a diabetic diet, and sort of looking at the food in a way from a nourishment perspective of what is this food going to do for me and how is it going to manage my blood sugar levels. The Canadian Diabetes Guidelines recommend a low energy density and high volume foods to optimize satiety and discourage overeating. We all know this information, yet many have less than 5% long-term success rate if it comes off sounding too much like a diet. Mindful eating can be an alternative for those who find this approach more helpful in managing their blood sugar levels. So how I use this with people in the office is looking at it from more of an awareness area of our hunger fullness cues to decide how much at certain times of the day is necessary for their body. If you notice, the orange areas are labeled awareness areas. So if we get to the table starving or ravenous, it's really hard to make a conscious choice of what foods are going to help to manage my blood sugar levels and what quantities are going to be satisfying. So it might revolve around looking at what happened in my day, led me to the table coming starving and ravenous. Did I miss my snack? Did I get called to a work meeting? Did I have no appetite at a certain time of the day? Was I too full from the meal before and that delayed my eating? So it's looking back to see what behaviors are helping and which ones aren't. And similarly, the other awareness area, slightly overfull and stuffed, it's looking at how did I get here in the first place? What was it that triggered me to getting to a place where I wasn't able to recognize my fullness cues, or maybe I chose to ignore them, which sometimes it's okay to do that. And did that influence my blood sugar levels? Ideally, more often, we want to stay within the green area, coming to the table feeling hungry, and getting away from the table feeling either satisfied or perhaps full, depending on what levels work for our bodies. So again, this is just an awareness tool to see how much does my body need? How high do I stack my plate in terms of what is going on for my body? And it may change day to day as well. So keeping in mind this is something we have to learn to be flexible with, because different scenarios will change these levels. And by being more mindful, I can do this more intuitively and naturally, rather than prescriptively. This is why we kind of look at the plate that all foods can fit. That it doesn't necessarily have to be we follow a diabetic diet, but we need a mixture of carbohydrates, proteins, fats, and fluids with a dose of mindful eating to help get our blood sugar levels in a manageable area. The Canadian Diabetes Association guidelines encourage adequate intake of carbohydrates, fiber, fat, essential fatty acids, which might be omega-3s, proteins, vitamins, and minerals. As evidence is limited for the rigid adherence to any single dietary prescription, nutrition therapy and meal planning should be individualized to accommodate the individual's age, type, and duration of diabetes, concurrent medical therapies, treatment goals, values, preferences, needs, culture, lifestyle, economic status, activity level, and readiness to change and abilities. A mixture of all these foods is thus encouraged, but how to balance this depends on your own body. It's really an experiment, which some find journaling can be helpful, like the one provided in the resource list, to see how different patterns, quantities, or combinations of all these foods impact your own blood sugar management. You can complement this with being mindful of your hunger-fullness cues or how you feel before and after meals. Everybody does this a little bit differently. That's why how is more important than what we eat. Not all carbohydrates are created equally. True, but not all are digested equally either. A calorie is not necessarily a calorie. Being mindful with what's on your plate and how much can have different interactions with your blood sugar. Many are told to follow a low glycemic index, which is how quickly food rises your blood sugar levels. The glycemic index is impacted by what we call the glycemic load, how much of that food you have and what you pair it with it. Playing with combinations on your plate, like mentioned on the slide before, and checking your blood sugar levels 2 hours post your meal, or checking in with how you feel. Were you satisfied, too full, hungry shortly after, can help you to figure out the meal pattern, on average, that works best for you. This would help you to get more of what we call the orange line on this chart. Eating frequently throughout the day so that your blood sugar levels stay stable. And if you remember back to how the body works, the body prefers to have enough throughout the day spread out so that it's not getting those peaks and valleys, which is the red line. So as we come to the end, I want you to think about what is one thing I can do today to be more mindful in managing my own diabetes. Often we get stuck on the problems, that we have very, very, very little energy to focus on the solutions. So often it's sort of reframing our thoughts. Rather than focusing on what I can't do because of my diagnosis or because of my limitations, what's one thing I can do? And how can I be more mindful? It might be a slow process, but the fact that you're sort of learning to relook at things, to become more aware, it's really hard to change without that awareness. So take a look at what you're doing, and this link to the recorded webinar will be sent out through Netiq. Re-listen to this presentation a few times. We went over a lot of information, and see what information is helpful for you. You may not have to use everything in this presentation, but just taking a look at what's working and what's not, you can start looking more at the behaviors, actions, things that you need to do more of or less of that'll help you to manage your diabetes and your blood sugar levels differently. A lot of the information that was presented today has come from these references. So for those of us who have more of a clinical background, feel free to check these out to get more of the journal articles or the books that I used to prepare this today. And of course, these are some other resources that are more mindful eating resources. Eat What You Love, Love What You Eat with Diabetes is a book that I use a lot in the office to help people again look at diabetes a little bit differently and their behaviors. The Fearless Blood Glucose Monitoring Worksheet, if you Google that, you can find it. It's just a different way of monitoring your blood sugar levels to also include some of those mindful tools. And there's a really great website developed by the author Michelle May and Migrit Fletcher, Diabetes and Mindful Eating. There's lots of really good articles and worksheets on there as well. And of course, I mentioned Eat Right Ontario. If you want to connect to a dietitian, feel free to use this free resource. The Center for Mindful Eating, if you want to learn more about mindful eating in itself, this is another resource that's available to you. So I want to say thank you to you for listening today, and keep in mind that mindfulness is awareness cultivated by paying attention on purpose in the present moment, non-judgmentally.
Okay, so we can open it up for questions now, if anybody in the room has any questions for Kori about the presentation. as usual, you can type into the little box at the bottom right if you have a question or any feedback. Okay, well, once again, I'd like to thank everybody for coming in this afternoon and for accessing the webinar. And thank you so much to Kori again for her presentation. As usual, everyone will receive the recording of this presentation and the slides about a week from today. And if you have any questions or feedback for NETIC, you can reach us at netic@uhn.ca. For those of you who don't know, NETIC is a nonprofit organization that's based here in Toronto, Ontario, and we're able to provide these webinars because of donations and support from people like you. So if you would like to learn a little bit more about NETIC, you can visit us at www.netic.ca. Thank you everyone for coming, and we'll see you again soon.